morning, and welcome to Talk of the Town on 99.7, 1450 WHTC and WHTC.com.
And we welcome you to Talk of the Town for this Monday, June 15th. The Ides of June, if you want to call it that. My name is Gary Stevens. We'll have open line following the 10 and 11 o'clock news. We'll be joined in less than an hour by Patty Vandenberg, What's New Around Howland. In our 10:30 segment, being the third Monday of the month, we'll be joined by first-term Republican State Senator Roger Victory of Hudsonville. But in our first half hour, we're joined by first-term Republican State Senator Aric Nesbitt of Lawton, who represents Allegan County in the upper chamber. He joins us via the Zoom connection. Aric, good morning and welcome back to Talk of the Town.
Good morning, Gary, and look forward to being in person hopefully next month.
Well, let's hope so as well. I'm going to pose you a question that our colleague, WTVB in Coldwater, Ken Delaney, did to State Senate Majority Leader Mike Shirkey. Going to get your hair cut today?
The barber shop I go to doesn't open on Mondays, so they'll be open tomorrow, but we'll be in session. So it has been. I think I looked at my schedule. It was February 23rd was the last time that these locks got sheared. So
yes, sheared is a good way of putting it for both you and I am afraid.
I think there's about a pound up there. So
yeah,
my wife and I, we've been in solidarity with our barbers and cosmetologists, and so we haven't cheated, haven't went to somebody else, and I think her appointment is next Tuesday, the 23rd. I haven't called to set up mine yet. I don't know. It's wild. I'm starting to get maybe used to it a little bit, but it's kind of short compared to my dad's hair. He was always a very long-haired hippie, so with a full beard and everything. So
yeah, yeah, go ahead.
I'm just happy to see a lot of these small business owners getting back to work this week. 2 weeks ago, we held a hearing on this, and it is something where there's tens of thousands of hardworking Michiganders that have been unemployed, and it's good to see that returning back to work and doing this safely. And it's good to see some of the studies that using proper hygiene and mask wear and everything, it shows that they can go back to work safely, and it looked like they could have done that a few weeks ago. And so but it's good to see them back this week.
If you got a question for State Senator Aric Nesbitt, he'll be happy to answer it at 395-1450, 395-1450. Let's talk a little bit about the Senate Majority Leader. I don't know how involved you were with the state Republican convention that was held virtually over the weekend, but Senator Shirkey said in his remarks, we need to replace fear with what he calls the humble confidence and hope that comes with freedom. I'm not certain if you were involved with that or in terms of the convention or not, but Senator Shirkey says that fear of motivating residents to trust in the heavy hand of government is knowing better than the hearts and minds of citizens and how to deal with the coronavirus.
Yeah, and I think that's the state party had their convention this weekend on Saturday. It was a virtual convention, and the Senate Majority Leader has been pretty outspoken over the last month and a half, 2 months on the fact that we need to start trusting the individual citizens to do the right thing. This is the challenge with self-government, is that the trust shouldn't be fully on the government; it should be on the citizens making the right decisions. And so as I look at it, is that we know what the drivers are, in terms of dying from coronavirus. It's age, it's underlying health factors, it's weight, it's vitamin D deficiencies. And so these drivers, as we look at it, I think we need to be taking a risk assessment of who's most at risk of being hurt by it, and those that aren't most at risk should take precautions through common sense things such as, whether it's limiting the group size, social distancing, mask wearing, washing your hands, other things like that are fairly common sense. And I think as we look through this, that I think a lot of these drivers, and we've seen in Michigan with the deaths here, is that one of the big drivers is the nursing home policy that was set by the governor months ago. And when you're seeing that a lot of the cases could have been stopped if they wouldn't have put COVID positive patients back into nursing homes or long-term care facilities with COVID negative patients, that I think a lot more people would be alive today than have passed away. And these are some of the same policies that you saw in the Northeast, in New York and New Jersey and Connecticut, is that the driver for this is trying to prevent this from the elderly and those with underlying health conditions. And so I think we need to take a risk assessment of where things are at, and push folks to get back to work and use some common sense ideas and thoughts, and trying to work safely.
It seems as if we've passed a threshold to a certain extent. We're at stage number 5, according to what the governor is saying about the different stages of getting the state back into circulation. Just one more to go, and of course that's not going to come until we have herd immunity and a vaccine, and being able to get us back to some semblance of normalcy. How concerned are you and other Republicans about maybe revisiting the situation if we have a second wave and the governor decides to take action similar to what she did during the first wave? How concerned are you that some of the concerns that surfaced during the first wave might just come right back up again in the second wave?
Well, the drivers is that we have testing capacity that's there, and we need to continue to have broad, in-depth testing capacity around the state, so that anybody who wants a test is able to get that, and that folks in high-risk jobs, whether it's nursing homes, healthcare providers, emergency responders, those that work in meat packing plants, those that are really on the front lines, can get tested, and get tested regularly to make sure that those, whether they're showing signs of infection or symptomatic, are able to get tested and get those responses quickly. Remember, back in March, it was taking upwards of 2 weeks for folks to get responses on their tests, whether they were negative or positive. And remember, back in March, we had challenges with personal protective equipment for our frontline workers. All that has been stepping up. And so the point is that as long as we have good broad-based testing, that people take responsibility for their actions in terms of making sure that if they're feeling ill, that they stay at home, that they stay away from their parents or grandparents, that they actually look at trying to keep other people safe. And it is something where if you do have it, try to trace back, go through, and who you've been in contact with, and encourage them to get tested also. And so I think as you look at this, is that whether it's a second wave or a third wave or what have you, is that the point is that if you have the proper testing capacity, and that people are able to take those actions into consideration, and not just avoid getting tested, that I think we can avoid some of the worst parts. And we know who are most affected by this. As I said, we know what the drivers are for death: age, underlying health conditions, especially if you have diabetes or you're overweight. And so take those precautions and work on getting back. And a lot of the drivers, as we've looked at it, that also in terms of the spread is people that are speaking loud, that are in close proximity to each other, and that are in atmospheres such as whether it's in crowds that are in closed areas. But even as we look, folks outside or being especially heat around, that you just don't see those same drivers. And so I think a lot of this is what folks, I think a lot of scientists are saying, let's take proper precautions. And the medical experts have said, know what the real drivers are. The risk is folks being in close proximity, talking loud, yelling at each other, things like that.
The reason why we're bringing this up, by the way, we're talking with State Senator Aric Nesbitt of Lawton. If you have a question for Aric, he'll be happy to answer it at 395-1450, 395-1450. The reason we're bringing this up in a little bit more of an extended way with him is that since the last time I chatted with Aric, which was a couple of months ago because Peg was taking care of things last month for me, but you were part of a joint select committee on the COVID-19 pandemic with the House and Senate. You were named as one of the vice chairs of the committee. And is that committee still a viable situation, or have we gone past maybe having the governor's actions being reviewed by this type of committee?
I think it's very important. I'm the Senate lead for the bipartisan, bicameral COVID-19 task force. It's a committee that combines both the House and Senate. There's 10 of us on there, and we're really reviewing the entire action set out by state government. And so as you look at it, the whole goal is to look at the good, bad, and ugly, because there were some good decisions, there were some bad decisions, and there were some really ugly decisions that were made. And I think looking at all those decisions, every lever of state government was used, and how was it used? What were the ramifications? And this is the challenge here in Michigan, is that what was the drivers that created here in our state that we had the worst death rate in the Midwest? What were those drivers? There's a lot of assumptions, but what's the reason that Ohio has a quarter of the deaths, or a third of the deaths, half the unemployment rate, a quarter of the budget deficit that Michigan is facing? What are those drivers? Illinois, large populous state. Same thing. And so what are the drivers that we're looking at is really doing a full review of all the actions. And what I'd like to see is really a model as we get out of this, is that what is the appropriate actions and what should we have together? Because we've seen some of the governor's actions, that she didn't step up early enough, whether it was calling an emergency in March. It took her 3 weeks to declare an emergency, state of emergency here in Michigan, to get federal aid and help for PPE equipment. There was a lot of confusion from the administration, continued on these executive orders. We've had, resident after resident, small business owner after small business owner, unemployed person after unemployed person testify, dozens and dozens of them testify about the confusions of the executive orders. Do we listen to what she says in the press conference and the executive order and the hundreds and hundreds of frequently asked questions? People on unemployment, hundreds of thousands still not getting, her forced economic suppression laid off about 1.7 million Michigan workers. Again, the most unemployed people in terms of percentage of our workforce, next to Nevada. So again, 49 out of 50 states. What were the drivers for, even though the economic suppression was so much more here in Michigan, yet our neighboring states were able to do it earlier and get control better? What data and science was being used from their health experts that was driving those decisions to be able to come with solutions that so far have a lot better outcomes than what we've seen here in Michigan? And so we've been reviewing the unemployment agency. It doesn't seem like any heads up was given to the unemployment agency to staff up, as hundreds of thousands of people were forced into layoffs. We had the LAR director last week, which is the licensing and regulatory agency. They said they've had, going over what their plans are in terms of licensed companies and small business owners to get back to work safely. She testified last week that they submitted a plan May 21st to the governor on getting hairdressers and barbers back working safely. They had a work group, heard nothing from the governor's office for weeks. And then all of a sudden, after we held this hearing 2 weeks ago, 3 days later, and got a lot of attention, she got a lot of bad headlines. And then 3 days later, she announces on June 15th, you can begin to open. So what changed over those 3 days period that then they can decide 10 days later that they could actually open? And so there's a lot of questions that we're trying to dig down deeply. This is going to be a very thorough investigation. I think we've already held 15 hours worth of hearings. We're going to continue over the summer. Representative Hall from Marshall is the chair of the committee, and we're going to continue to work on this to what I hope is provide recommendations and a better model on how should have we responded better, and how can we be better prepared in the future.
395-1450. Let's take a call. Good morning. You're on the line with State Senator Aric Nesbitt.
Yes, good morning. I can agree with some of your things, but I really think you're putting down our governor quite a bit. I think she did a fairly decent job, and I just don't like to hear you condemning some of the things. Yes, she was inconsistent on some things, but, she was caught between a rock and a hard place when Detroit, which seemed to have most of the issues. I know she thought maybe they were going to come to West Michigan, which we were very fortunate they didn't. But I think you Republicans are just sour grapes, and you just got to be a little more thankful that it worked out like it did. Yeah, maybe we had more deaths, but I think she did a good job. And if you make any comparison to the guy that's in the White House, that was a total disaster. And he didn't show any leadership at all. And I think compared to her, she did a pretty good job. There's plenty of things to say about it, but let's talk about the good things.
All right. Appreciate the call. Thank you very much for it. Aric, your response, please.
I mean, strong and decisive action, I think, was needed in terms of capacity in the Metro Detroit area. And that's why I'm saying we need to look at the good, bad, and ugly. But what were the drivers in Ohio that the Ohio governor was able to do shutdowns and executive orders earlier than the governor? What data and science was driving them in Ohio that resulted in a third of the deaths that we saw in Michigan, that resulted in half the unemployment rate that we're seeing in Michigan, and a quarter of the budget deficit that we're seeing in Michigan? Leadership does matter. And I do think we were all on board the first few weeks of strong and decisive action. But if we're, if we're going to be looking through this, I think we gave the governor a lot of leeway that first few weeks to make these strong decisions to protect the residents of the state. But what we're seeing is that Michigan, in terms of the effects of what we're actually seeing, and I hope we look at what the actual outcomes are. If you look at per capita deaths, we'd be third, fourth in the world. We'd be higher than Italy if Michigan was its own country. If the United States, if you look at the U.S. as a whole, the U.S. has about half of the per capita deaths than what Michigan has. And so these are just facts that we need to examine. What went into the decision making? What actually were the drivers in those decision makings, and how did other states be able to respond quicker, have PPE and testing more available, and what were those that happened? And so I understand that we all have to provide some grace, some patience, some thoughtfulness as we go through this. But as we've seen over the last, especially 2 months, 2.5 months, that the governor's gone it alone without the input of the Michigan legislature, without the input of your state representatives or senators, or at least being able to give a heads up. We hear about her new executive orders at her press conferences or when they're actually sent out. And so so I think that's just part of the challenge that we need to look into. And I think it's a responsibility for all of us. That you're right, the top priority is clearly health of the people of our state, but the governor's orders have gone farther than other states, and that has really damaged our economy. She banned landscapers, builders, and other professionals that could safely operate that our surrounding states never banned. She stopped important healthcare procedures, which harms people trying to stay healthy. Then there was a ban on fishing with a boat with an engine. But what was this? What was the drivers on that? We do need people to stay healthy, but there needs to be common sense as we look at this.
Aric, I do need to get to one more topic before, if we have time to get callers, we will. Because at the first of the month, auto insurance reform kicks in. You are very important on that, and I wanted to get your thoughts as we get closer to this deadline.
Yeah, it was signed into law a year ago and 2 weeks or so up on Mackinac Island. Those were the days when we only had health auto insurance to talk about. But it goes into effect in July. You'll have a choice in terms of the coverage. Most of your auto insurance insurers should have sent out some wording. You can keep the plan you have. There's nothing wrong with that. You can keep that for as long as you'd like, or if you'd like to have some other options, that's when you can start looking at some plans that'll be saving you some money. But you've already seen the MCCA respond to it by a rollback of the MCCA fee from $220 to $100. So already $120 savings for every car owner in the state. And that's just the start in terms of the options that you can take a look at. So the first series goes into effect next month. And then there's a second phase that goes into effect next year in the summer, which should have additional savings.
Let's get to a couple of calls before we button things up. We have about 2 minutes to go. Good morning. You're on the line with State Senator Aric Nesbitt.
Good morning. We hear how many people have died from COVID-19, but our governor left the abortion clinics open. She should tell us how many babies have died during the same time because of the abortion clinics being open. Thank you.
Appreciate the call. 395-1450. Good morning. You're on the line with State Senator Aric Nesbitt.
Oh, good morning, Stevens. Good morning, Aric. You've done a wonderful job for people in Allegan County. I want to know more about the Saugatuck State Park. The Holland State Park is overcrowded. They've been talking about building a parking lot close to Lake Michigan on the north end of the Saugatuck State Park for about 2 years, and a lot of elderly people and handicapped people can't walk 3/4 of a mile from the existing parking lot. I think you should push the DNR to build a parking lot. There's a lot of areas where they could build it, especially in the north end of the Saugatuck State Park close to Lake Michigan, and that would be very good for the tourist industry in Allegan County, especially in Saugatuck.
All right. Appreciate the call. Thank you. 395-1450. It's been this one caller definitely has been pushing for that for a while.
Well, and hopefully the lake level does not go up any higher. Hopefully this is the highest we'll see in my lifetime. But I think a lot of infrastructure projects right now, we should wait to start seeing some of the lake levels recede. The unique thing here in Michigan is that we do have a natural resources trust fund that helps people access the outdoors. And it was set aside by Michigan voters in the early 1980s that state sale leases on gas and oil production in the state, all that money goes into a trust fund that local governments or the Natural Resource Department can draw down. And there's actually, I think, about $800 million in that trust fund. A few 10 million is allocated every year to enhance outdoor recreational opportunities. And it sounds like the local municipalities or the DNR should be looking at that real trust fund, because tell you what, to tap those money. I'll tell you one thing though, the state's broke right now, and so there's a real challenge we have when after 3-4 months of an economic suppression and pushing people out of work, it means you don't have money for priorities such as so many things that our state and local governments need to do.
State Senator Aric Nesbitt, as always, we appreciate the time you spend with us, talk about some of the issues that are going on in Lansing. We'll put a link to your webpage when we put the podcast up on our website at WHTC.com. And right off the top of it, help with unemployment claims. And we've gotten some complaints about unemployment as well. It's going to certainly help. Aric, thank you.
Thank you. God bless.
All right. Thank you very much. Aric Nesbitt on 99.7 and 1450 WHTC. CBS News is next on the hour, followed by Peg McNick with WHTC News. And then we will have some open line time. Penny Vandenberg, What's New, Ron Howland, and State Senator Roger Victory joining us in the next hour.